Malcolm.
Do you want me to take that microphone, or then I can drop it?
Are you a wanderer?
I can drop it if I say something really significant. Okay, I've worn my green shoes today. That's about as green as they come, just as a note. And this is actually my forest in Northern Ireland, where I come from. So first of all, I thought it would be useful to do a proper kind of welcome. So tēnā koutou katoa, ko slīv gallion te monga, ko lagan te awa, ko ototahi te hanga, ko Malcolm Campbell tōku whenua, no reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. So I'm a geographer, and one of the things I think that's really important about geography is this sense of place and how important the environment is to us. So I was born in Belfast, where the Titanic was built, and the joke is that it was fine whenever it left Belfast. So, as I say, I'm a geographer, and I'm interested in basically the connections between health and environment, primarily. And I also direct something called the GeoHealth Laboratory. So this presentation might be slightly different in that I'm coming at it from more of a health perspective, rather than necessarily about trees per se, but about how that impacts on our health. So I'm really interested in kind of health outcomes, health behaviors, and well-being more generally. And how we come at it as health geographers is usually through something called exposure to green space, to tree canopies, and things like that. So this kind of crazy map here is all the moves that I've done over an entire year in Christchurch on one map. So what we're interested in understanding is how people move through the environments and how that might impact on their health. And for reasons that are still unclear to me, I also have 4 nationalities. So that's what those flags are about. Right, so I'm going to talk about 3 things. So first of all, I'm going to talk about the kind of where, primarily because I get to show you lots of maps, and I really like maps, but also to poke at this idea that actually finding the data is one of the hardest things for us in terms of understanding the environment. I think that theme came up right at the start. I'll say something really quite briefly about why green space broadly matters for health. I'm sort of skating over a lot of literature here, so hopefully you'll forgive me. And then I'll talk a little bit about kind of how the policy or what the policy response might be in terms of a health perspective. So hopefully that sounds okay. Yeah? We're still awake, just about. Awesome. Great. It's absolutely roasting, isn't it? Right. So what I thought I'd do is, of course, show you some maps. And one of the things that I'm really, really keen on is making things accessible, reproducible, easy to use. So for those of you who noticed in the previous slide, I kind of use techniques around programming languages, big data, and maps. So if you're interested, these are the kind of green spaces, broadly speaking, in Christchurch. And then we can add on measures of accessibility, so 5, 10, 15-minute walks. This is the University of Canterbury as an example. So as you can see, we're quite close to quite a lot of green spaces, so that's good. And what we do every year is we have a class of about 100 students, and we get them to track themselves and their interactions with green space, link it to their mental health, all sorts of other outcomes. So we use these kind of techniques on students. If you're interested, and again, the slides will be up, there's code that's reproducible online. If you want to try it yourself, change Christchurch to wherever you come from, and you can have a bash at that in terms of some of the code that's here. If you don't like code, you can copy and paste it. So that's just Christchurch then. In terms of the wider picture, one of the things, again, is it's not just green space, but signaling that there's a whole range of environmental kind of influences on health. And we've done this for the whole of New Zealand, of course, so again, pointing out that there is spatial variation across the country. And you can see the darker greens, if you can see them. I'm actually red-green colorblind as well, so it's always fun to draw green-red maps. You can see that the darker greens signify better access to green space. So the first part of any of our kind of studies of health is actually getting access to the data on green space that's comparable, even at one point in time, never mind across time. So why does it matter? So for those of you who aren't really in the kind of health sphere, There's all sorts of large framework diagrams for health. And this kind of diagram here is one of the more famous ones. It's really quite old now. But basically, there's all sorts of things that determine our health: age, sex, individual factors, right up to tree canopy, green space, those kind of impacts at the environmental level. So again, just signaling that it's one component, but something that we're really, really interested in understanding. And then we have other features that we've talked about over several presentations already around the built environment and how that impacts on health. And also the use of green space more broadly to facilitate social and community connections, which perhaps is something we haven't talked about just yet. So here's a really quick summary of why green space matters to health. Some of my colleagues do not like the speed at which I go through this, but there is evidence to say that there's a strong impact between the proportion of green space that we can see that is accessible to us and all sorts of physical and mental health outcomes. So we've got these ideas that it's important for relaxation, social connections, physical activity, how close we feel to nature. And then we've also touched on some of these other kind of broader or more global challenges around things like it's important to mitigate against climate change. As the planet urbanizes, so we're now more than 50% urban, of course, it makes that more palatable. And then even ideas about health inequality, so the difference in access between different people is something that we're really quite interested in. There's a long literature over 30 years that is basically showing, not quite conclusively, but very strongly, that there's a really positive influence on exposure, both seeing green space, so this stage is particularly good for my mental health, and also being able to access green space for all sorts of health conditions. So you find that people report that their health is better when they have more access to green space. There's reduced morbidity, so illness, less stress, less obesity, less cardiovascular disease, and less respiratory diseases. And we think this works through 5 key mechanisms. So it might be through things like better air quality, for example, the promotion of physical activity, social interactions, as I've mentioned, restoration from stress and fatigue. So after this conference, you might want to go for a walk in the park, particularly if you're an introvert, and recover some of that, and sort of emotional or spiritual experiences, which I'll leave alone for now. Perhaps you can engage in those later. So if we believe green space impacts our health, how might we respond? And this is the part, hopefully, of the presentation where I come back and land the plane into the kind of things that this audience might be interested in. So the first thing, which I think really strongly resonates with what Simon said right at the start, is this idea that monitoring and measuring green space is really important, just to know where it is in the first place, but also to understand that kind of accessibility for whatever group it is we're looking at in the population. So without that data, it's really hard to make any assessment. And so you'll probably be familiar with the kind of 3-30-300 rules, or the idea of 15-minute cities, which seems to have veered into conspiracy theory lately, which is slightly unfortunate. So maybe 16-minute cities might be better. And then, of course, we want to understand the sort of when, where, why, who of green space use. And so how we come at that is that we want to track people everywhere, not because we're kind of creepy stalkers, but because we actually don't know who is using green space, for how long, for what purpose, all those kind of things. So how it varies by time of day, say, which specific green spaces are most used, who's connecting with who. So if you remember the COVID-19 app, we can use Bluetooth to infer social connections, how it varies by life course or stage in the life course, those kind of things. And then the other thing I would poke at is that this idea that measuring of quality of green space is really quite hard as well. So again, even when we get data, it's usually just it's there or it's not to a certain extent. So all green space is equal, but some green space is more equal than others. For those of you who know the novel that comes from, that's either funny or not. And then I guess the really hard stuff is the changes over time. So as someone who's interested in geography, as we see urbanization, population growth, all these sorts of things, how is that changing over time? We've seen some kind of evidence maps of that, but that is the really, really hard stuff to do well over long periods of time, and again, to link that back to health. So that's all from me. This is me around the University of Canterbury. So again, you can see very strong patterns from individuals and populations around how they use green space. I always park my car here when I parked at uni, so if you want to steal my car, that's where you go. Or if I was looking for a walk by the stream at lunchtime, you can see that patterns as well. So it's that kind of data that we need to really understand what's going on. And that's all from me, so thank you very much.